All right, my next guest knows that health insurance can seem like a foreign language that none of us speak. Well, she does. Deductibles, premiums, tax credits. Where do you even start? And more importantly, where do you end up? Emily Trevino with Wise Insurance is here to make it simple and may even help you find a plan that costs $0 a month. Good morning. Welcome back.
Thank you for having us again.
All right. Let's start with ACA Obamacare. So a lot of people, we hear the term over and over again, but a lot of people aren't sure what that is.
It's basically insurance for individuals and families who don't have insurance through their employer. So it's a two-part system, really. The first part is to see if we can get the federal government to pick up and pay part of your premium, which would be great, especially since they're going up. But regardless if they qualify or not, they can actually still get an insurance product that will help them with all their health care needs.
And that's different from Medicare.
Very different than Medicare. Yeah. Normally we're here talking about Medicare, but now this is for anyone under the age of 65 that just needs health insurance.
Yeah. All right. When should they apply for that?
So it starts November 1st, which was on Saturday, and it'll run through January 15th. But with all the crazy government shutdowns and things like that.
What? There's a government shutdown?
Yeah. Yes. The airport's feeling it right now. So, but yes, I'm encouraging people to get started on it earlier, just so that you know what you're dealing with, can make decisions. Plus, you just want to ease into Thanksgiving, have your healthy meal, like you were talking about earlier, and not have to worry about what you're going to get on.
Yeah, and then when you're kind of at the head of the line, your things might be processed a little sooner, right?
Exactly, and you'll know exactly what your out-of-pocket costs are going to be. And again, what we're trying to do is bring that transparency, that education, so that people understand, hey, how much am I going to actually have to pay for? Because it's not just the premium, it's all the out-of-pocket costs, and we want to make sure it works for them in 2026.
This is something that I would not want to have to figure out myself, and that's where you all come in. Wise Insurance, you're a whole office care team, comprehensive services offered. You help with all kinds of things.
Absolutely. So a lot of people are going to say, hey, you know what, health insurance is too expensive for me. I'm just not going to get it, and I'm going to highly discourage that.
Right.
We have solutions.
Let me just say, one of the number one reasons people end up in deep debt is a medical emergency, right?
Absolutely, because you know, disease, cancer, heart attacks, like
divorce.
they don't, divorce, stress. They don't let us know like when it's going to happen, right? So health insurance is there to help protect you when it does happen, and it is very expensive. And a lot of people are like, well, I'll just do cash pay or I'll go on a billing plan. Well, you know, if you have a kid who's playing football and they tear their ACL, that surgery is going to want their money up front before you get it done.
And the reason why I threw the divorce in there was I had a friend who didn't realize, she completely forgot about it when she got divorced. She was on her husband's insurance.
Oh, yes.
So when they got divorced, she was like, uh-oh, I'm vulnerable now. So.
Oh, absolutely. And here's the other thing too. If you find yourself in a situation, a life change, you have a baby, you get married, you have a divorce, throughout the year, you have a time that you can actually change. It's usually only within 60 days. So you got to be like on top of it.
All right. Free Medicare services. We know we have open enrollment right now. So you are helping people through that open enrollment, because again, that's something else that can be very confusing. And you hit the nail on the head when you said, if you've had changes, you really need to take advantage of going over your plan.
Absolutely. We have to look at your doctors. We have to look at your prescriptions. We have to look at your medical concerns to make sure we put you in a solution that's going to help you for 2026. And what's interesting is a lot of people will call us about their Medicare, which we love that, but they forget that, hey, they have a spouse who doesn't have Medicare yet. Yeah. So we make sure we offer the solution that's best for the whole household, not just the one person.
Yeah. What if you're someone you're working and you still have health insurance, you qualify for retirement, but you're still working, you have health insurance with your company, but then Medicare. Do you decide which one to take, or do you stay on your?
Well, that's a great question. It really depends on their employer, how many employees there are, and what your plans are. What we like to do is look at a comprehensive plan of what they currently have versus what they could have. And sometimes we'll say, hey, look, the employer plan's the best route for you to go. Sometimes we say, hey, look, there's a big savings on the Medicare side. So we compare both of them for them.
Yeah, thank you, because again, there's a lot of confusion. The government shutdown and the tax credit confusion is just, it's hard for us to understand.
That is all over the news right now. Premiums are going up on everything, not just ACA, not just on Medicare, but even employer plans. Like, people are going to be really shocked in 2026 what their deductibles, their co-pays are, and their premiums. So we're going to all ride this wave together in 2026, and hopefully 2027 will get some reprieve. I doubt it.
You pointed out several times of why a care team matters, but it was even down to the point, I think it was you who said the other day, even if you're in a different zip code, things can change. change in terms of who?
Yeah, based on
you
your
have plan?
county.
Yeah.
Absolutely. So especially like Fort Bend County and Harris County, they'll share some of the same zip codes. Same thing in Montgomery County and Harris as well. So we have to look at what county you live in and make sure that you qualify for those plans. And again, like we talked about earlier, you can qualify for a zero premium plan. So you just have to give us a call and let us see if you can qualify.
Yeah. What happens if someone was laid off?
If you're laid off, one thing I will say is COBRA is very expensive. So I would suggest giving us a call. Let us come show you what the cost is for your COBRA and then compare it to what it is, what other solutions we have for you.
Yeah.
Until you transition into your new opportunity.
Yeah. They always say when you're aged, the eyes are the first to go, followed by the teeth. Okay, so dental and vision coverage is one of the things that people oftentimes have questions about. That gets tough sometimes.
It absolutely gets tough. A lot of them think it's already included in your dental, especially in Medicare. They think your medical covers all that. It doesn't. It's a separate product that you have to get. And I always tell people they want dental and vision after it's too late.
Yeah.
So like you can't call me when you need the root canal, right?
Yeah.
So we make sure we offer affordable options for people. We shop it around. We represent so many companies across the U.S. so that we can make sure it's affordable for them.
So if your dentist has already said to you, it looks like you've got some periodontal disease here, you jump on that dental plan.
Yes, exactly. We want to get you on it early. There are waiting periods for some services, but a lot of them can be covered pretty quickly. So
All right.
that's good.
This is one of those things that people want to get on, and a lot of times they try to go it alone. But one thing they need to do is avoid the health insurance scams, because there are con artists out there who are, snatching people's personal information or selling them something that they don't need.
Exactly. And so one of the things that we tell people, a lot of you're going to see that on digital, or people sending you some random texts. You can always opt out of those. I always recommend working with somebody who's local, to where you can find them at their local office, so that you know that they're a credible, trusted resource that's there for you. We offer a care team because we want them to be able to find doctors, answer questions about their medical bills, things like that, all throughout the year. So it's not just this season, but it's like, hey, we need someone to advocate for us all year long.
Yeah, you said find doctors, which brought up something else. It's like, okay, but I already have a doctor. Are you sure they're still in the network?
Yeah. And that's the crazy thing is doctors can accept and terminate a plan any time of the year. So when that happens, a lot of people get stressed and feel that pressure. Give us a call. We'll either help you find somebody new until we can get you into a plan they accept, or you just can't go to them, or it's cash pay.
Yeah. Well, the wise thing to do would be to call y'all.
That's right. That's the wise choice.
That's right. Thank you very much. All right. Give yourself peace of mind this open enrollment season and give them a call at 832-699-3334. Again, that number is 832-699-3334. You can also find more information online at wisehealthins.com. wisehealthins.com. Be wise and make your appointment today. Don't let your child help you or your grandchild, because they don't know what they're doing.